Well, good morning and welcome everyone to this episode, an educational module about breathing with pregnancy. Now, we have to remember that we are breathing for two while we are pregnant. So let's start this learning process and learn how pregnancy affects your nose.
Phenomenal. So just to do quick introductions, I oversee our strategic partnerships with Intake Breathing. My name is Wesley Balmer, and I'm joined today with a good friend of mine, Dr. Karen Parker Davidson. Dr. Karen Parker Davidson is a phenomenal educator, one of two of the leading experts in the world on rhinomanometry. And I'd love for KPD for you to introduce yourself.
Hello, everyone, and thank you for allowing me to be a part of this journey with you, Wes. As the contracted clinical director and educator for Intake Breathing, it's really important for me to get this message out that breathing is not just something we have to do for survival, but as a function. This journey began for me back in 1991. So it's been quite a while, but more specifically looking at nasal function and flipping the script and educating the public as well as providers over the past 8 years. How do we quantify nasal function? What is the importance of nasal function? And we have to look at this in every aspect of our life, from birth to our elderly state. So with that being said, Intake Breathing has given me an excellent opportunity to bring this message to the public. And we're going to start this week with pregnancy and go through the different stages of life, as well as different stages of diseases, and how intake breathing is such an amazing, compatible adjunct therapy to use with CPAP and other types of treatment options and interventions. So we have to understand that one of the greatest challenges in this world is knowing just a little bit of something, just enough about any type of a subject. But, we have to think we're right. But again, there's so much more to learn. And it's not enough about the subject to know that you're wrong.
That's an interesting way to kind of kick us off. Tell me a little bit about what are you hoping to kind of reveal here? I mean, there's a lot of education out in the world right now in regards to pregnancy. There's a lot of people talking about the benefits of supplements, of vitamin levels, of all of these different ways to protect baby and to protect mom during pregnancy. So is there falsehoods out in the world right now? Is there things that you want to make sure that we correct?
Yeah. Well, that's a great question. I'm glad you asked that because this has been a flooded market of airway. You've seen mouth taping. You've seen, stand on your head and spin 3 times. There's been so many social media trends. Are they clinically proven? Not really. And so we have to be really careful because, Mama Bear, you're carrying an extra little bit of cargo with you.
Phenomenal. That was a great introduction. And so this is a great, pregnancy. I'll tell all the audience right now, and I'm a student today learning from you, KPD. My wife and I are expecting our firstborn son next month.
Congratulations. Very exciting.
Thank you. And, ever since we found out that we were pregnant, my wife has been using the product. And I am so excited to meet this little boy who has been oxygenated since he was, dreamt up into this world and came into the womb. So I'm so excited to go through this material with you. Mm-hmm. Lay it on me. Thank you, KPD.
Oh, my pleasure. So we have to look at the pregnant nose. What is happening? You feel stuffy. Well, we have to understand, again, those hormone surges of estrogen and progesterone. Now, we're going to go the other end of the spectrum, Wes. On the other end of the spectrum and what I work with and deal with, menopause and postmenopause, it's kind of a double-edged sword. When we're pregnant, the progesterone and estrogen surge cause more congestion and affect our ability to breathe, right? Well, when you go to the other end of the spectrum in menopause, when estrogen and progesterone decrease, now we get sleep apnea, another breathing problem that's affecting our sleep. Well, why is this? Because progesterone and estrogen are 2 hormonal engines that help in our respiratory rate and our respiratory breathing. So we have to, again, now you can see the connection between hormones and nasal function and our breathing patterns and what's triggering us to breathe. These are the engines during pregnancy.
So I love this really clear, it's like almost if I was watching or if I was driving down the road and I saw a billboard, the pregnancy nose. So what is the pregnancy nose? Teach me as if I know nothing about this.
The pregnancy nose. It's the stuffy nose. That's the best way to describe it. The stuffy nose. And it comes from estrogen. Now, when we look at the hormones and we look at estrogen in particular, we get more blood flow to the tissue in our nose. And then we also have a little bit of changes in nitric oxide production because of that stuffy nose. And that's all. Nitric oxide is always present in our nose. But at what level will depend on the level of congestion. Now, congestion is pretty much an acute issue where nasal resistance is more of a chronic issue. So we got two different phenomena going on. We've got the congestion from the swelling of the mucous membranes from the surge of estrogen that, oh, well, by the way, now it's affecting the flow coming into the nose that affects the amount of oxygen we're able to intake and uptake. No pun intended, intake. But now this is going to have an effect on nasal resistance, how that air is able to get to the lungs. Now we have estrogen that acts as a natural respiratory stimulant, okay? Meaning it tells your body to breathe. And this is what I was referring to, that the two hormones that causes respiratory induction and breathing patterns is progesterone and estrogen. And over time in pregnancy, that elevates. Then you've got more, it's kind of like this seesaw. It's like more progesterone that affects the breathing patterns and it's a respiratory stimulant. And then you have estrogen that comes to the party and causes more swelling in the mucous membranes of the nose.
The pregnant body is a magical place, but it's a very challenging environment. So I'm curious. You talked about the importance of like nitric oxide intake and uptake. So when we face congestion, when the pregnant body faces congestion, and you're deprived of sufficient nitric oxide during rest, what kind of impact does that have on the pregnant body?
Yeah, so nitric oxide is produced throughout our body, mainly in the endothelial cells in our blood vessels. It's also produced in the nose. It's always present in the nose. And what that does is it's kind of a vasodilator, not kind of, it is a vasodilator, and it allows for more calmness. Now, if you don't have enough calmness and you don't have enough vasodilation or opening of the blood vessels, things get a little constrictive and you can feel kind of anxious.
What for the pregnant body during the first trimester? I mean, again, my wife we're expecting our first baby boy next month. The first trimester was pretty challenging for my wife to endure. She faced nausea. She faced, pretty severe general discomfort and fatigue. Like what does nasal breathing and improved nasal function? Just to say that more clearly, how does improved nasal function overall impact health and wellness during the first trimester?
Well, and I want to go before pregnancy. I like to see women who anticipate or who are trying to get pregnant do prenatal care before the prenatal aspect. So if I could recommend anything to any lady who wants to have a baby, prepare your body for pregnancy. What does that mean? Have your nasal function in place. Have your nutritional aspect in place. Have your lifestyle in place. Get the body ready to carry on this extra load of work that you're going to anticipate. Remember, there's a lot of, more blood production. So again, more congestion that you're going to feel. So that first trimester, again, you're going to feel that there's so many things happening in the body. And I have a 19-year-old, and I still remember how I felt. I didn't have nausea. I wasn't really tired the first trimester, but the second trimester, he actually broke my rib. So he cracked it. And I remember the huffing, the puffing, because also as the baby grows, it's going to have an impact on the diaphragm. Now, there's a concept called the breathing brain, and I have this as a little video. It's an actual active MRI that shows with nasal breathing how the brainstem kind of goes up and down, and the fluid or the cerebral spinal fluid in our brain moves around. It's quite fascinating. But really, what's important is that there are two cranial nerves that bypass right to the brain, and that's the olfactory nerve and the optic nerve. And that's that olfactory nerve that plays a huge role in how we send that message to the brain in breathing. And that's been proven in research and studies that we can see that more nasal breathing has better brain wave function.
I want to ask you just one more follow-up question.
Sure.
You talked about intake, you talked about general preparation for like prenatal care. And, thinking about this through the lens of like markets and some of the messaging that you see in like marketing messaging, in supplementation, in food, prenatal preparation is pretty important. And, I think that overall it'd be interesting to understand from your perspective, what role does nasal function have on the prenatal preparation?
You have to understand that nasal resistance, that little precursor to actually sleep apnea, is very slow. It's very sneaky, it's very insidious, and it's silent. It's cumulative over time. So your breathing problems accumulate little by little. It's like weight, a pound, a pound, a pound. And then you look at the skin like, whoa, where did this come from? That's the same analogy with nasal function, nasal breathing, or nasal dysfunction. So if we can prepare the body for prenatal care in advance through functional breathing, good sleep, that's the best you can do for you and your baby. So here is a concept. It is out there and it's in the literature. It's called pregnancy rhinitis. Well, pregnancy, obviously. Rhinitis is a runny nose. What is pregnancy rhinitis? Well, again, here we go with these crazy hormones, and we have the hormonal connection where the swelling and congestion impairs the airflow through the nasal passages. And then our bodies are smart enough to go, what's going on here? And then we rely on mouth breathing because we can't nasal breathe. Then again, we throw in the swelling. And what happens is when we try to produce mucus in the nose, if there's allergies, the nose is smart enough to say, wait a minute, I need to clean this out. Well, what happens? If it's trying to stay uncongested, it will literally try to auto clean itself out by producing more rhinitis, more fluid. So you can kind of see this circle here. We go from the hormonal connection to the swelling of the membranes to more nasal congestion to think, okay, I want to do my own little self-cleaning, my self-rinse. Then the sinuses will produce more fluid. And then we get the rhinitis. And so you can see how the rhinitis of pregnancy, we'll call it rhinopathia gravida. Gravida, pregnancy. Rhinopathia is rhino, nose, pathia, disease. So nose disease, pregnancy. It's kind of backwards, but rhinopathia gravida. So you can look this up. It is in the research. Not a lot of research on it, but it is there. And so again, when you look at the hormonal condition, and we got the runny nose with pregnancy, it is common, ladies, nothing to be, upset about, but also let your doctors know so we can kind of monitor this because it could be an allergy as well. A funny story I have seen, and it happened to me. I was never allergic to anything until I was pregnant with Zach. And I never had curly hair until I had Zach. So, I had wavy hair. So a lot of crazy things can happen to us. But again, in this situation with the runny nose, it is common. It does happen. You'll see it more in the second trimester than because of that influx of hormones. But again, it could be activated by allergies, a cold, or any type of sinus infection as well. And here's another thing: your teeth. If you have a sinus infection during pregnancy, it could be a tooth problem. So don't always discount the teeth and the oral care, because the oral care is directly related to nasal care. So it's kind of a 1-2 punch. We have to look at these two phenomenons in our face. The natural way to breathe in the nose and the emergency exit route, which is the mouth. They play a huge role. But in the end, Wes, we really want to stay away from mouth breathing, because we get into mouth drying that can cause dehydration. And that's a whole nother concept we have to look at in pregnancy. We don't want to be dehydrated. Is that helpful?
So helpful. Thank you so much, TPB.
Sure.
I'm excited to move on.
So let's look at the nasal anatomy. We've talked about nasal function and breathing. It's all over social media, but let's break it down into these little pieces and parts that are really, really important. We see 30% of our nose on our face. The other 70% is behind the mask, so to speak. It's in the nasal cavities, behind it, around our eyes in that area. And when you look at a pretty nose, I always say a pretty nose does not mean it's always functioning well. So we have to remember that. We also have to understand that nasal volume, or the width right here of the nasal bone, this first vault in the bone area, does not necessarily mean better function. That's another kind of myth out there, that I have a bigger nose, so I'm going to be able to breathe better. Now let's dial that into intake. A bigger band does not mean it's going to give you better breathing. It may, but it's not going to give you better function. We'll talk on that a little bit when we get into more product characteristics. But for all intents and purposes here, the key is the nasal valve area. Now, over 50% of upper airway resistance occurs in the nose. Of that, 2/3 of resistance occurs in this first 1 inch of your nose. This is where intake has the value, an incredible value. We have to focus on this 1 inch of our nose. And that's really important when we get into tab placement, right? So the nasal valves, over 50, maybe 70% of airway resistance occurs at the nasal valve area. And we have two. We have two sets. We have the internal, which is right above around the inferior turbinate, or the first turbinate. We have external nasal valves that are right here around the rim of your nostril. So we have two sets of nasal valves, and we can test those at home. When you go to use intake, we have two tests you can do at home to know exactly what's most beneficial for you. Then we have turbinates. Turbinates kind of slow the air down, have the warming ability around the middle turbinate, have the filtration aspects of it. And we have three: inferior and middle and superior. And here's a fun fact, Wes. Some people even have a fourth turbinate way up in the back of the nose. It's an anomaly, but some people have a fourth turbinate. Then we have to look at the mucosal changes. Now, again, the pregnancy hormones will affect this, and it affects the mucosa. You could get inflammation of the turbinates and whatnot. And that, again, is going to alter our airflow. So we want to understand why these airflow changes are happening. This might seem redundant, but the message needs to be heard. We have to look at breathing in oxygen, the effort of nasal breathing. Now, when we breathe in, our noses work 1.2 times harder already, okay? Now you add on congestion. Now we have to get that airway more open for more oxygen uptake and intake. And again, the oxygen delivery to the cells and even down to the mitochondria and how they function, because this goes through the placenta to the baby as well. So there's that breathing for two concept again. We also have to look at air filtration. A clean nose is so helpful to filter out the harmful bacteria. Again, 95% of viruses that are respiratory in nature are entered through the nose. We saw this during COVID, so it's not too far, it's not too far woo-woo or off the chart, but there is a connection there. But I also want to point out one thing. When we look at airway filtration, we have normal flora in our noses. We have good bugs to fend off the bad bugs. What I don't like to see is nasal rinsing, because here's why. Nasal rinsing outside the presence of mucus in the nose. There's a place for it here, right? Nasal rinsing prophylactically or preventingly outside the presence of mucus in the nose can actually have a reverse effect and predispose you to more sinus infections. So let's talk about that airway health for a minute. If you want to do nasal hygiene, if you want to do nasal cleansing, there's some gels out there in the market, like there's a nasal cleanse gel, and they'll use that just to clean out the nostril area. If you want to do a little nasal cleansing spray or a little bit of saline spray, that's fine. But if you don't have that mucus present and you're going to rinse out and do this lavage and nasal lavage, that can have a reverse effect. More sinus infections. Now, here we go again into the pathogens that are now affecting you and potentially affecting the baby. Now, let's throw in the component of stress and anxiety. This is very common, ladies. I felt it. I remember sitting there doing my nursing notes in the month of March. Now, I had Zach in the month of July. And in March, this panic just hit me. It's like, oh my gosh, I'm going to be responsible for this child for the rest of their life. This little human being. What am I going to do? I literally had a panic attack. No lie. I had a panic attack sitting there writing my nursing notes, and I froze. And I was doing home infusion therapy at the time. And I just sat there and I froze. Wes, it was the most bizarre thing. I'm like, what just came over me? It was hormones. So, ladies, and to the husbands, that feeling of, stress and anxiety, here we go again. Nasal function, nasal breathing, there's breath work out there as well. And I also have worked with a world-renowned breath work practitioner. I talked with him last week in Russia, and I told him, I'm like, breath work only works as well as a nose that takes the next breath. And how are we going to fix that? Structurally, intake breathing.
Yeah.
So intake was introduced to Russia last week, but going back to this, so we want to reduce the stress and anxiety because we're already in a stressful situation as it is. And again, sleep quality. Sleep is so important. I know the market focuses on that more than our daily nasal function, but it is really important to have that sleep. And especially before midnight, there's information out there that says we get more of our restorative sleep before midnight. We need to clean the content out of our brains. We want to be healthier. Positional sleeping is fine, as well as with intake.
Thank you so much, KPD.
Mm-hmm. Sure. And so again, nasal obstruction can lead to poor sleep quality, induce snoring, and have an increase, and I don't like this word, but it's the industry, sleep disordered breathing. Now I'm going to chime in here for a minute and say, here's my little bee in my bonnet. I kind of recreated this term sleep disordered breathing because sleep does not disorder our breathing. Our breathing disorders our sleep. What's really important to understand is that when we look at sleep quality, sleep duration, and how we have that risk of fragmented sleep or sleep problems with nasal congestion, it all comes into play. It's all full circle. So we go from the nasal obstruction that has decreased airflow, that has altered resistance, in our nose, that goes under the throat, that affects the pressures back there, that'll cause a collapse of the structures that we need. So it's a pressure flow relationship, right? And that pressure flow relationship starts in the nose. So that nasal obstruction is going to induce poor sleep quality because of disruptive breathing patterns, and it's going to make the snoring worse, and have a downstream of healthcare implications that we've talked about, like high blood pressure, even in pregnancy, gestational diabetes. So you can see how dependent the body is on proper nasal function. And how do we create these new management strategies? Again, simple homeopathic sprays. Always check with your doctor, but anyone can use intake without a prescription. Anyone can do that. And now that we're having this awareness with more providers and all these different provider initiatives and partnership programs, I think this is really going to help get the message out.
Yeah. It's an interesting, so, as we've developed this relationship, I really heard you use nasal dysfunction as like the leading kind of like descriptor for overall, like the topic of what we're talking about. And I notice here that we use the word nasal obstruction. And so just, I want to make sure that I'm really clear on my terms. What is the difference between nasal dysfunction and nasal obstruction?
Nasal obstruction is temporary. It is acute or short term, where nasal dysfunction is accumulation of nasal obstruction over time. So nasal obstruction is very short term, such as the cold, the flu, allergies, where nasal dysfunction is an actual problem that's chronic. It's been going on for longer than 3 to 6 months. It could be structural. It could be mechanical. It could be biochemical. There's a lot of different things. It could be the gut. It could be so many different things. So obstruction is kind of what we feel. Dysfunction is what we can measure. So it's pregnancy, more than sniffles, how it's going to affect you. Again, the rhinopathia gravida, nose dysfunction during pregnancy. It can have more sniffles than you could ever want. And how is that going to affect you? Again, we talked about rhinopathia gravida and how mouth breathing will disrupt your sleep. Again, it comes down to nasal swelling from pregnancy that the hormones will cause, making the nose more harder to breathe. That will lead to mouth breathing. If it gets to a certain level and you can't breathe through your nose and the mouth just opens up as an emergency exit, that mouth breathing will dry out the oral cavity. It'll dry out the airway. Also, you can get that type of snoring at the base of the tongue. It disrupts your sleep, and then it'll affect your maternal energy. But let's go one step further. We can go into nosebleeds and voice changes and snoring. This is true. Mouth breathing, if you're outside of nasal function and nasal breathing, we have hyper and hyponasality. Our voice can change with nasal obstruction and nasal dysfunction. Well, what's that going to do to you? Over time, there's some things that could happen out with drying where you could get nosebleeds. Again, the estrogen will increase the blood flow to the nasal lining, make it a little bit more difficult to breathe. Then there's more swelling. You can kind of see this trend here of how everything is connected hormonally. And then you see more common snoring. Any type of swelling obstruction is going to cause higher resistance. And how does the body respond to resistance? Mouth breathing and snoring, because the air is trying to get through and it's trapped. It just can't get through. And then you have the vibrations and reverberations in the back of the throat. So this is what's happening. But again, always discuss these loud noises, or discuss if your partner's saying, hey, I hear you snore. Snoring is not sexy and it's not funny. And it's not cute in children. But, I always say snoring isn't sexy. Always talk to your provider. If your partner is saying that you're snoring, really take that to heart. Have it looked at. Have it investigated.
Because mouth breathing in pregnancy disrupts your sleep. That affects your energy, maternal energy, your focus, your immune health. But everybody that is experiencing nasal dysfunction who mouth breathes during sleep, does everybody experience disrupted sleep and lack of energy, lack of focus, and impacted immune health? Does everyone experience that? Or is that just pregnant people?
Oh no, that's everybody. Those are classic symptoms of sleep apnea. Daytime sleepiness, daytime drowsiness, fatigue, foggy headed thinking. Oh, yeah. So, but, here's another thing, too, we want to look at. Let's talk about quality of life. Oi, pregnancy and quality of life effects and nasal function and how this is all coming together. Of course, we have discomfort. Again, we talked about this. Excuse me. We talked about the discomfort. The baby is pushing on the abdominal muscles, the diaphragm. You've got pressure going upward, downward, and sideways, right?
And then later in pregnancy, when baby's developing the neural connections, he starts having dance parties.
You know what? And I remember those dance parties and the sore back. The lower back aches. So yes, and it almost seems like, it's kind of a funny story, but the children are so responsive in utero. Here's an example. So we're in the middle of mass, and during the homily and the responsorial songs, Zach, he was having a dance party. The music stopped, he stopped. So our children in utero are so responsive to our environment around us, outside and literally inside. So now we have to look at these quality of life effects that we're having. Again, we have discomfort. We have fatigue. Your fatigue is baby's fatigue. Then we have reduced physical activity. Reduced physical activity will have venous pooling. The blood flow kind of slows down. We got to keep that motion going there. Then we have the social interactions. I know mamas out there that it was just like you just don't feel like going to things. And that can really have a mental health impact as well. And when we pull all these things together and we look at our daily tasks that we have to do every day, the cooking, the cleaning, the mood changes, these are all of these emotions we're going through affect our overall well-being. But is there a connection to all of this, the discomfort? And yes, all of these variables here affecting our quality of life can also be translated into how we nasal breathe and function. So can better breathing help these aspects of our quality of life? And the short answer is yes. That's why we say breathe better, feel better, right? Breathe better, sleep better. Now you can see the connections.
Amazing. Mm-hmm. Thank you.
Now let's get into the fun things. Nasal breathing is important for exercise and mobility during pregnancy. Again, we touched on that with the quality of life, how blood flow with a lack of activity can get rather stagnant, right? So what does that mean during pregnancy? This is why I love intake as an adjunct to pregnancy. Not just pregnancy, but for every aspect of life and any age from 5 years on up, according to industry standards. But here we have enhanced oxygen uptake and intake. So key, so important in exercise. We have improved endurance, which can kind of, fight off that fatigue, right? And then we have increased comfort. If we can move the blood flow, relax the muscles, we feel a little bit more comfortable. Then we have better respiratory efficiency. Again, the baby's pushing up on the diaphragm, pushing up on the lungs, and we get short of breath. We all get short of breath. But this exercise and blood flow increase, oxygen uptake, more relaxation can give us a little bit more functional efficiency. And also, if we look at temperature and humidity regulation, that is important. Again, don't overheat, stay hydrated. And then it all comes down to stress reduction, better mental health, better quality of life. But here's the most valuable role. And I have to say I'm obsessed. I am obsessed with this because I can mechanically manipulate that nasal valve collapse, that physical structure that's causing so much stress. I can mechanically manipulate it and keep it stable. Now, the typical strip, the other one, the flexible one that looks like tape, What's interesting is that after an hour, it loses 25% of its efficacy. Oh, wait. But if you sweat, it comes off. Oh, wait. It doesn't give one amount of pressure to another amount of pressure. It's the same consistent pressure on different noses. Well, how's that going to work for an individual? So here we have the role of intake, 6 sizes, because we have small, medium, large, 1 and 2. And I will tell you, in my experience, I use usually the S2 on my ladies, S1 on my children, M1 and M2 are most popular on my guys. So here you can see how intake is really having an impact. I want to be very clear on something. If you want the best optimal airflow with intake, when you put that on, when you put the band on, of course you can see nasal valve collapse. When you put that on, you shouldn't see your nostrils wiggle. Now, when you breathe in with an exhale, like when you breathe in hard, the negative pressure makes everybody's lateral walls move around. That's just nature, right? But here, when you put the band on, you want to make sure that those nostrils are stable. And when you take a deep breath in, make sure they're not moving around, because then you have a positional problem. But here's the role of intake with nasal valve collapse and how it will provide stability consistently with the amount of tension that you need. So what is the solution? Intake. Well, what is intake? Intake is an external nasal dilator that comfortably supports the nose and creates a consistent amount of tension and pressure to the outer sides of the walls of the nose to keep the area stable for better airflow day and night. What are the benefits of nasal dilators? Well, nasal dilators have been around since the 1990s, but we're going to jump now into the 2020s and where intake made its debut and huge impact. And I say that with passion and without reservation. It's made a huge impact. The benefits of nasal dilator are many. It will improve airflow. It helps open the nose to calm down the resistance, to increase airflow, for better sleep, enhance oxygen delivery, uptake, and intake. And here's the beauty of this, Wes. This is what I love so much about this. Intake can be used alone or with adjunctive therapies. So let's go over saline sprays and humidifiers to actually soothe nasal tissues and relieve congestion. Now, I want to hit home on something because I've seen things on social media and it caught my attention. Vicks Vapor Rub. Vicks Vapor Rub, do not put that near the nostrils. Do not put that in your nose because it has camphor, and camphor can be toxic to nasal mucosa. Don't do it. You leave it on the chest, but don't put it anywhere around the nose. The other thing is petroleum jelly, Vaseline. If you feel like your nose is getting dried out, there are other products on the market that I love that work. But if your nose is getting dried out, do not put Vaseline in your nose. And here's why. The Vaseline itself, if you inhale quickly, it can get into your lungs and create what's called lipoid pneumonia. And that's caused from the little Vaseline petroleum jelly droplets in your lungs. So that's why we say don't put that in your nose. Don't put gobs of Vaseline in your nose. What you can do is with intake, use saline sprays, humidifiers to moisten the mucosa and soothe those nasal tissues and relieve that congestion. Again, you're going to have more relief from the congestion, a little bit more comfort, engagement in that, prevention of infections because we like to have that nice warm environment. It's also safe for pregnancy. And it's easy to use. Again, always check with your provider, but these are some of the things that we can recommend. In addition to the environment, we have to look at air quality considerations. Now, y'all know we can breathe some polluted air. So we want to minimize our exposure to allergens, pollutants, and the dry air that can keep those nasal passages quasi-comfortable. So, how do we do that? Allergen reduction, pollutant avoidance, use of air purifiers, hydrate, 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 and hydrate. Avoid irritants whenever possible, as well as mindful outdoor activities. Now, fortunately, a lot of people already have their alerts for quality air alerts. So pay attention to those. But again, if we pay attention to what can trigger what happens in that first turbinate, it's called what I call the histamine turbinate. That first turbinate is the one that will swell and respond to a lot of these pollutants. So let's just use caution when we're outside. So let's take a few of these summary and key takeaways. In pregnancy, hormonal changes will increase the level of resistance and congestion in your nose from higher levels of estrogen, higher levels of progesterone, leading to these downstream effects of what's happening as far as our difficulty in breathing. Self-care strategies. You know what I say? Self-care is good care. Whatever you need to do for yourself. It's not selfish. It's self-full. And there's a difference. So take advantage of those opportunities. Mindful breathing, intake with yoga position and meditation and breathing, so helpful. And also with regular checkups and check-ins and any kind of disruption you're having in your nasal function, nasal breathing or sleep, always get that tended to, as well as your mental health. So thank you for joining us.